So a lot of times there's confusion about the time frame about rotator cuff healing and repair. And it's a hard topic to talk about with somebody who has a rotator cuff injury. They have failed conservative measures, meaning therapy, injections, medications, or even avoidance. And now we're talking about surgery. And we have that discussion in the clinic that if you're going to have rotator cuff surgery, it can take 4 to 6 months to get back to 85 or 90%. And some people will tell you it can take up to 1 year to get back to full function. That's a long period of time. People ask, why is that? So if you have an acute injury of your shoulder, you fall off a ladder, and we have diagnosed you with a rotator cuff injury, and it needs to be fixed. If it's an acute, brand new injury, we've got about 2 to 4 weeks to get in there and fix it. Or if you wait, that can affect the long-term outcome. Most rotator cuff repairs are from wear and tear, long-term wear and tear. And what we know, we see you 3 to 6 weeks. We try conservative measure. That means physical therapy. That means treating the inflammation. Sometimes that means injection. So we're trying to decrease the swelling or inflammation in the shoulder. We're trying to increase the muscle tone of the rotator cuff and the shoulder blade muscles. If that fails, then obviously you're down here to surgery. Now, if you have surgery, there's a predictable protocol that we put you in. The time frame will change depending on the tissue quality and bone quality, but they're basically the same. So phase 1 after surgery is 4 to 6 weeks. If the tissue quality is poor, or if the bone quality is poor, it's more towards 6 weeks. And if the bone quality is good and the tissue quality is good, we're more towards 4. But this is a maximum protection time where we're letting that tendon heal. We stitch that tendon back down to bone, and we're maximally protecting it while it heals. As far as physical therapy goes, we're only working on passive motion. The downside is you're in a sling with a pillow. 9 times out of 10, you're sleeping in a recliner or propped up. You're working on pain control, and you're using ice. The really downside is you can't drive, and I don't want you traveling for the first 3 or 4 weeks, because if you have a hard time, we can't get to you. The second phase of rotator cuff recovery is the intermediate phase. It's about 4 weeks. So phase 1, we've allowed that to heal, and now we're in the intermediate phase. The goal of physical therapy is we're going to increase the motion of the shoulder, and we're going to work on strength that does not put force across the repair. What does that mean? It means we're working on rotator cuff strength if you're pulling in and pulling out. We work on rotator cuff strength up to about shoulder height, but no heavy yanking up off the ground and no overhead function for this phase 2. One of the major focuses of phase 2 is shoulder blade strength, and you can think about this as posture. We're trying to get you to pull your shoulders back. We're working on seated rows, lat pull downs. That's not going to put force across the graft. So again, phase 2 is a protected phase. We tell you 5 to 10 pound weight limit. Most of your function should be from the waist to shoulder height. Phase 3, so now we're almost 2.5 to 3 months into it. We're working on overhead and overall rotator cuff strength. This is a progressive process. It really depends on how you've progressed through phase 1 and 2, how long that lasts. The next phase is a phase 4. Some people use phase 4, some people don't. If you're trying to get back to a specific overhead sport, if you're trying to tennis, or if you're trying to throw, then phase 4 is sport-specific strength training to get you back to your sport. But again, as you can see the time frame for rotator cuff surgery, it's not a quick time frame. It's very difficult here in phase 1, and it can take 6 months to a year to return to full function.